Thank you, Betty. This is Jovita Dominguez, Chair of the Education and Licensing Committee. I would like to bring this meeting to order. I'd like to take the opportunity to do roll call, please. Present, Jovita. Mary Fagan.
Mary Fagan's here.
Susan Naranjo.
Susan Naranjo's here.
Thank you. Quorum is established. I would like to take this opportunity to say that Agenda 8.9 has been moved to the November board meeting. So that will be off our agenda item today and will be placed on November's. And BRN moderator, would you please take us to open public comment for today's agenda, what is not in the agenda?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment."
This is Jeanette. Can I help you?
Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. This brings us to 8.2. I, Jovita Dominguez, would like to move to approve the ELC minutes for June 24th, 2021. Do I have a second?
This is Susan, I'll second.
Thank you. I would like Susan Naranjo second, so I would like to take second the motion. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. I, Jovita Dominguez, will call the vote to approve the June 24th, 2021 meeting minutes. I vote yes. Mary Fagan?
I'll abstain. I was not a member of the committee last meeting.
That's right. Thank you. Susan Naranjo?
Yes.
Motion carries. Mary Ann McCarthy, would you please bring us start our 8.3, please?
Yes, I will. Good morning.
I'm going to interrupt really quick, Mary Ann. Thank you. Sorry about that. Just a quick format change, just to make sure that all the committee members and the board members that are on the meeting following along. There was a change to the way that we will be doing this ELC committee. Marianne McCarthy is operating as the liaison for the committee meeting, and to come into alignment with what we've done for nurse practice, as well as our LEDGE committee and our EIC committees, Marianne will be the one that will present on all agenda items. The NECs that are associated with the individual schools will be on and available if our committee members have any questions, as well as a school representative. But for the purpose of aligning with our other committee other committee for the liaison role, we did update Dr. Marianne McCarthy's role, and she will be doing all of the presentations going forward. Thank you.
Thank you so much, Lori. This is Marianne McCarthy. I am the liaison to the Education and Licensing Committee. And we will move on to agenda item 8.3. Discussion and possible action regarding whether to recommend ratification of minor curriculum revisions, acknowledge receipt of program progress reports, and whether to recommend ratification of clinical facility approvals. According to board policy, nursing education consultants may approve minor curriculum changes that do not significantly alter philosophy, objectives, or content. Approvals must be reported to the Education Licensing Committee and to the board. A list of the schools who have submitted minor curriculum revisions, clinical agency and facility approvals, and program progress reports that have been approved by a nursing education consultant are in the materials packet under corresponding names. These are consent agenda items. Thank you.
I, Jovita, make a motion to accept agenda items 8.3. Do I have a second?
This is Mary, I'll second.
Then any committee discussion? Since there's no committee discussion, BRN Monitor, would you take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Marianne, will you please restate the motion?
Absolutely. The motion for agenda item 8.3 is to recommend ratification of minor curriculum revisions, acknowledge receipt of program progress reports, and recommend ratification of clinical facility approvals.
Thank you. I, Jovita, will call for a vote. I vote yes. Mary Fagan?
Mary Fagan, yes.
Susan Naranjo?
Susan Naranjo, yes.
And motion carries. Thank you.
Thank you very much. The next agenda item is agenda item 8.4. Discussion and possible action regarding whether to recommend approval or acceptance for approved nursing programs. You will notice there are 4 sections under 8.4. All of these are consent agenda items and are listed as continuing approval of pre-licensure nursing programs, continuing approval of advanced practice nursing programs, initial approval of advanced practice nursing programs, and substantive changes to an approved advanced nursing program. The BRN staff have received and reviewed all documentation from program requests that are listed in Agenda Item 8.4. Information on these requests is on your list provided in your materials packet. These programs have met all board rules and regulations that are related to the requests and are consent agenda items. Thank you.
I would like to make a motion to accept. Do I have a second?
It's Mary, I'll second.
Thank you. BRN monitor, would you take us, is there any committee discussion? Thank you. BRN monitor, would you take us to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will now give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. I, Jovita, will call for a vote. Jovita votes yes. Mary Fagan.
Mary Fagan, yes.
Susan Naranjo.
Susan Naranjo, yes.
Motion carries.
Thank you so much. Agenda item 8.5, discussion and possible action regarding clinical practice experience required for nurse practitioner students enrolled in California-based nurse practitioner education programs. The BRN staff have received and reviewed all documentation from program requests listed on agenda item 8.5. Information on these requests is on a list provided in your materials packet. These programs have met all board rules and regulations as related to their requests and are consent agenda items. Thank you.
Does the committee have any questions or any comments?
This is Lori, the executive officer. I just wanted to make sure that you guys were aware that these were the items previously covered in the nurse practice committee. It has now been moved to the education licensing committee as this is pertinent to education. Additionally, you will find this information in a new table that has been created and is in part of your meeting materials. On our website, the listing of the out-of-state nurse practitioner programs are there. And if you did a simple search in the right-hand corner and just typed in out-of-state, the first search result popped up would be the nurse practitioner programs. On that website, it is in alignment with CCR section 1486. It does have the forms that need to be completed for our out-of-state nurse practitioner programs to show that they have met that regulation. And then below is a listing of all the schools that have been approved, their locations, and a link to their website for further information for RNs that are licensed in California that are looking to go back to obtain their NP and want to do NP clinicals here in California. Thank you.
So since we don't have committee discussion, BRN monitor, would you take us to public comment? Or I'm sorry, I must, maybe we need to do a motion first.
Yes, please. Thank you, Jovita.
I motion that we accept 8.5. Do I have a second?
I'll second. It's Mary.
Thank you, Mary Fagan. BRN Monitor, would you take us to public comment, please?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Then that brings us to, I'd like to get.
Would you like me to restate the motion?
Yes, please, Mary Ann. Would you please reinstate the motion?
Thank you. I will restate the motion. The motion for 8.5, recommend approval of clinical practice experience required for nurse practitioner students enrolled in non-California-based nurse practitioner programs.
I, Jovita, call for a vote. I vote yes. Mary Fagan,
Mary, yes.
Susan Naranjo,
Susan Naranjo, yes.
motion carries. Thank you.
Thank you so much. Agenda item 8.6. Discussion and possible action regarding acceptance of a program progress report with discussion and possible action to address any performance gaps, including actions described in California Code of Regulations, Title 16, Section 1423.2, Subdivision A, for East Los Angeles College Associate Degree Nursing Program. East Los Angeles College is on warning status and is submitting the progress report that is required at each meeting. The board paused enrollment of ELAC admissions in the fall of 2021, and the spring 22 semester begins February 7th, 2021. The last annual Nclex pass rate was 64.81. In preparation for this meeting today, quarterly reports were received from for the period of July 1st to September 1st, 2021. This result was reported as 73.86. However, the program is currently reviewing those results, and there are possible errors that may increase this score once corrected. This has to be investigated through the BRN. ELAC plans to enroll 30 students or more, if approved, in January of 2022. They have 3 remaining non-compliances that are in progress. One is their total curriculum evaluation, and we won't have a full total curriculum evaluation until all students have gone through the new curriculum at least one time, and then it will be ongoing. The hiring of medical med-surg faculty, the first position closed October 1st, and interviews are to begin the first week of November. The second position for a med-surg faculty is in the campus and district process for approval to be posted. The instructional aid assistant, who is the person who's working in the lab, interviews are taking place today. The Nclex pass rates is the third non-compliance. As we know, they are still below regulation. And the myself, I'm their nursing education consultant. So I'm available, as well as their program director, should you have any questions. Thank you very much.
So, let's see. I'd like to comment that I was happy to see that something as simple as an assistant was hired, because that takes a lot of time away from the directors and the professors. So that was good to hear, and I'm so happy to hear that they're making much more stride compared to our last meeting. Does any other committee members have any comments?
Marianne, can you restate what you said about you said, I think there's a concern that there may have been an error in the Nclex pass rate. Is that right? Did I hear that correctly?
Yeah, so what happens is the pass rates get reported to the BRN, and then we have Katie Darty, our NEC, is in charge of Nclex pass rates. She gets them all organized and sends them out. And by the way, to all the program directors who are out there, everybody's are not out yet. We just pulled ELACs because they were coming in front of the committee today. Yours are coming. And so we pulled theirs. And what the program directors then do is go through the list and ensure that everybody on there is really from their program and they did graduate and all that stuff. Occasionally, students click the wrong button and they get on the wrong Nclex list. And so we just want to correct that so that nobody on the list is from another school and on there inadvertently. In this case, the student changed their name. So what they graduate, it wasn't the same. So they came up, it looks like they're coming up as a different student. So we have to investigate the whole name change and make sure it's the right person and all that kind of stuff. Does that help, Mary?
Yeah, I mean, and do you know what it impact their percentage, success rate up or down?
Yeah, it looks like it would take it up to 77%.
Oh, great.
Oh,
For that quarter. So that's that is significant compared to how we ended the fourth quarter at 64.81. So that would be a huge jump.
yeah, fantastic.
And then real quick, Mary, this is Lori, just as a procedural and a moment to do some education. This is a typical process that we go through with our board and our Nclex results. So what happens is when the student applies for licensure through Breeze, they choose a school code. That school code is supposed to attach them to the school that they graduated from. What has happened in the past is some students have entered that code incorrectly. And so they have shown up on somebody else's pass rates. To clear that out, what occurs is when we get our annual reports as well as quarterly reports, the listing of every person that took the Nclex underneath that school code is shared out with that school director. They validate the names. If in fact there is a student on there that did not belong to them, they would contact us and we would find out where that student who inputted the incorrect code truly belongs, and then it would be corrected and assigned out. There is sometimes changes within those those reports. Those are done on a quarterly basis, quarters 1, 2, 3, and 4. And those are corrected by the time that it goes to an annual reporting. So the last annual pass rate is correct. The July 1st forward so the first quarter pass rate is the one that's in question right now. But the annual pass rate that was below our minimum standards stands. That has been validated. Going forward, on a side note, through our California grad process that was just updated and changed in August, this will pretty much eliminate that happening, because the program director will verify each student upon graduation in Breeze. So they will get a full listing of who has said that they have graduated from that school, and that'll be validated at the front end versus being corrected at the back end. So another bonus for us updating our process.
Great to hear. So I believe we can take it, BRN monitor, would you take us to public comment?
There has not been a motion.
Oh, I am
Rita.
sorry. I got confused. Mary Ann, can you restate the motion, please?
Yes, the motion would be to accept the progress report for East Los Angeles College. And I would also ask for the committee to allow them to admit students in the spring of 2022, their next cohort, and maybe give input on what that would be. If it could be their regular 30 students that they enroll, if it could be more based on their pause last semester, that I would like to add into the motion.
Do committee members have suggestions or comments on that?
Yeah, Susan, do you want to say anything? I have a comment I'd like to make.
Yeah, I mean, I know this is something that has come up pretty much in each committee meeting, and I'm ready to accept the progress report. But as far as the enrollment, I think of continuing 30 is fine. I'm not sure about increasing it, but I would like to hear more from fellow committee members and public comment on that part.
I think I'm pleased with the progress. I'm pleased that they have a director in place now, and if this last Nclex pass rate is going to come correct, that progress is wonderful. But I feel like if they start back up in the spring, which I think there's progress that they should, but I think in order to ensure that the students are going to be able to get the level of support they need, that maybe we should restrict them to 20 students for this first semester, just to see how things go. There's still some open positions for faculty, so I don't know if others want to have comments about that.
Mary Ann McCarthy, can you let us know what the enrollment pattern is previously approved prior to this change?
Sure. They were enrolling 30 students twice a year, fall and spring.
And then the last fall that we paused enrollments.
Completely,
And
yes.
so
No
the
enrollment.
Has the school contact you to start with 30 or increase? I was unsure. It said that the school plans to enroll 30 or more. Was that a school request?
Yes, yes. I mean, they would like to enroll more if possible. Again, the program director is available. If you would like to ask questions specifically to the program, we're happy to let her answer those questions.
I would like to hear from her.
Okay, thank you. Mark, could you elevate Brenda Chan, please?
And then while she is being elevated and Mark is finding her, Mary Ann, can you let us know on the annual Nclex pass rate? When we were having the discussions in May and June, was that the pass rate that they expected, or were they expecting something higher or lower?
My memory from the two meetings in June, May and June, is that they were kind of keeping their own tab on the people passing, as they talked to students or the students reported before it became official, and they were hoping and it thought that it was going to be higher. Yes.
And this pass rate is continuing to trend down. Is that my understanding?
Correct. This is the annual one of 64.81 is the lowest in the past 5 years. That was 2021. 1920 was 72. 1819 was 74, and 1718 was 75. So it has been dropping. Well, at least a point between 1819, 2 points between 1920, and then from 74 to 62. I mean, from 72 to 64 when we got to 2021.
What's the highest pass rate they've had since in recent history? Do you have that?
17-18, they were at 75.27.
How many students were they enrolling then?
I believe
I
their rate has not, their enrollment has not changed. They've been enrolling 30 students twice a year for some time now.
I could jump in actually on that one, Marianne, because I was the NEC. So
My
as
apologies.
that's okay. That's okay. As an NEC during that time period, the board had reduced their enrollments down to 20 twice a year. And then once they were able to bring their NCLEX pass rate up above the minimum standard of 75, we brought them back and forth in front of the board, and they received an increase going back up to 30 twice a year.
And do you know, Lori, was that in 17-18 when they got to 75?
I believe so. I think in the last 10 years, they've only been above the 75% threshold 1 year or 2 year. Do you have
Right.
that off the top of your head, Marianne?
I don't, but I think it is 2
I can
years.
pull
And I'm
that
pretty
quick
sure
as well.
17-18 was the one that, because they were on morning status before that. And I think that's when they went off because they came above and then unfortunately dropped back below.
I'll research that information real quick, Dr. Fagan, and we'll let Brenda Chan, the program director, speak at this point while I find that information for you.
Hi, Brenda, are you with us?
Hi, can you hear me?
I can. Thanks so much for being here.
Thank you. So thank you, Marianne, our NEC. You have been wonderful, very supportive. So thank you very much for your guidance. And
So they're
thank you.
asking about your enrollment, Brenda, about, you know, your our discussion about the continued enrollment and possibly increasing enrollment. Kind of fill the committee in on where you guys are with for the spring of 2022, what you would like to do.
Yes, absolutely. But I do have the Nclex numbers if anyone is interested.
Nclex numbers beyond what we just spoke about.
So I have the details. So for the past 10 years, we have 3 that's above 75%. And the highest quarter was 94% for 2018-19 in the July, September.
I'm sorry, Brenda, I have to interrupt you. We don't want to know quarters. We have to just know annual. That's all we can go on because the regulation is related to annual pass rates.
Yes. So 2017 to 2018, that's 75.27. 2018 to 2019 is 74.67. So rounding is 70. And then 2011 to 2012 is 82.26. So that's the number I have in front of me. But in terms of enrollment, we are definitely looking forward to enroll the 30 students that has been on hold. And since we have over 200 applicants, and we would like to know if we are allowed to enroll more. We have full faculty support. We have 2 consultants, Dr. Diane Breckenridge and Ms. Mio Minato, helping us. They're meeting with us weekly. We discuss student success strategies, and we are also looking at how to evaluate the present cohort that has started with the new curriculum in fall. So we have full support from the administration, and we are also have adequate clinical site if we need, if we can expand. So is there any other specific question you would like to ask?
Dr. Fagan, real quick, I was able to pull that information. So February 2014, the board placed ELAC on warning status, and with no change to enrollments. In September 2016, the program was continued on warning status. And so after that approximate 2-year time period, the board voted to decrease the admissions to 20 students twice per year from the previous 30 students twice per year. They did raise their NCLEX pass rates. And then in 2017, their annual pass rate was bumped up to 75.27. And in April of 2017, based on that progress report, they did grant the approval for 1 new cohort to go up to 30 students. And so it was after they had dropped down to 20 students the year before on admission in April of 17, when the pass rates went up, they were able to increase to 30 students. And so the annual pass rate for 2017, 2018, that would have been reported out in the July, of 2018. So that would have been after the increase of enrollment. So they would have increased enrollments of 30 students in the fall and spring prior to receiving that pass rate. However, that pass rate is indicative of the prior 2 years, because they have to be enrolled for 2 years, then sit for the NCLEX, and then get those results. So that would have been September 2016, so a fall enrollment of 20. A 2017 would have had 20. So there is no correlation directly with that pass rate and enrollment. It looks like that improvement to the 2017, 2018 pass rates came from the work that they were doing and not necessarily the decrease. It is important to note that I will kind of move swiftly through a 10-year NCLEX pass rate trend. The 2010 was 61%, 2011, 69%, 2012, 82%, 2013, 62%, 14 was 49%, 15 was 61%, 16 was 64%, 17 was 73%, 18 was 75%, and then 19 went back down to 74%. And then Dr. Marianne McCarthy has included in the packet the 20 and now talking about the 21 report, both of those maintaining under the 75% threshold. So we can go back historically to 2010 forward, where there has been 2 occasions that their annual pass rate has been above the 75% threshold that the board holds for approving nursing programs.
Thanks, Lori.
You're welcome.
May I add a comment?
No, Brenda, I just have a question. The 30 students who had been accepted and then have now been paused, are they all still ready to go in January?
Yes, they are ready to go. In fact, they have been, given a software program to help them stay engaged. And then because we are pending to know the board decision, once that's confirmed, we would like to give them workshop jumpstart so that they can start the onboarding process and also the ATI platform so that they will have opportunity to be successful when we can get them, started ahead of time, engage them. It's just this holding pattern is very difficult for us. Even today, we have students knock on our office door saying, are we enrolling? So we're unable to provide that confirmation. So a lot of students are very anxious out there. We do have adequate faculty to maintain 30, and also even more because we have hired several adjunct faculty, and we have full-time faculty position also. One just closed that we will be interviewing, and also put in student success coordinator. It's a full-time 12-month release, 12-month position to engage the advisement, counseling, simulation, tutoring, tracking performance, and all that. So we understand our past numbers has not been great, but I am very confident with our consultants and our faculty working together. We will move this program forward. We have a lot of student success strategies in place, and you will see the improvement, but only time can tell. But at this point, I think utilizing ATI, the Greenlight program, that's going to be making a difference for us because we have been on Kaplan for the past, I want to say 8 years, and we are switching and our students will see the difference. So the new curriculum again has been implemented for 1 year now. The students are in their 3rd semester. And with this Mio Minato's help, we have developed a framework to look at how to do the program evaluations. And we have been actively collecting data. I have a tracking form. We know every student in the programs, their current status. So we have done a lot of new strategies, and we have committees set up. We have what I call the CARES committee. It's an acronym, so C for curriculum, A for assessment and accreditation, R is for resource and research, E is for evaluation and equity, and S is for student success and scholarship. So we are very fortunate. We have great faculty that are really participating and motivated and also committed to student success. So when we got, I just want to give you a quick example. We got a scholarship announcement from our foundation office. So Dr. Carolyn Du and I, we quickly, let the students know, and they applied, and they each got awarded, a scholarship money. So I'm just would like to plea to the board that we are different now. We are new. We are not a new program. We are a program with long history. But with myself in this position, I'm a long-term faculty member. I'm really committed to this program's success and the student success. But again, we have Ms. Mio Minato, we have Dr. Breckenridge, and we have our NEC, Dr. Marianne McCarthy, and our administration. Everyone is on board. We will move this program forward, and we want to help our students to pass boards and be successful. So if there's any other questions I can, any other questions for me or answers I can provide, I'll be happy to do so.
Thank you so much.
And then just real quick, this is Lori again. I know that she is mentioning a couple of the consultants, and I want to give you guys some history on that. The board has worked with these consultants in the past with other nursing programs, and they have been successful in increasing the overall programs, including the pass rate. So those consultants do have a proven track history that the board is familiar with, and they have worked with other schools who have brought them into compliance with all board rules and regulations, and those programs continue to do very, very well. Additionally, Dr. Brenda Chan, the new program director, does have a longstanding history at ELAC, and she was previously assistant director for many years. And so she does have the historical knowledge as well as the relationship with colleagues and the ability to lead that program.
Very encouraging. Thank you, Lori. Since any other committee members have any comments? So I move, I make a motion, Jovita makes a motion to accept. Do I have a second?
Again, I'm sorry, Jovita, to interrupt, but again, I know we're going to accept the progress report, but I really would like some language about enrollment in the spring and those numbers, please.
Well, I would like to consider that we do accept the 30 students, no more than 30 students. Susan Naranjo mentioned that. Mary, what are your thoughts?
Yeah, I think since we didn't see a correlation between the number of students and the Nclex pass rate, and there's already 30 students that have been accepted and are waiting, I definitely support moving forward with 30.
Yeah, I agree. So I do move that we accept, but that we continue with the 30, no more than 30, and that they start in the spring.
Thank you,
Do I have
Jovita.
I'm sorry. Thank you.
Thank you.
Thank you. Thank you very much.
You're welcome. And I really hope to hear much more improvement in future. And I wish you guys a lot of luck and energy on that. Do I have a second?
This is Susan, I'll second.
Thank you very much. PRN monitor, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Mary Ann, would you please restate the motion?
Yes. The motion for agenda item 8.6 is to accept the program progress report with East Los Angeles College Associate Degree Nursing Program and allow admission in the spring of 2022 of 30 students, and to continue that their regular 30 students twice a year. Am I correct?
Yes, you are.
Thank you.
I Jovita votes yes. Mary Fagan?
Mary Fagan votes yes.
Susan Naranjo?
Susan Naranjo votes yes.
Thank you.
Thank you, everyone.
Thank you, everyone.
The motion carries. Thank you.
Great. Okay, agenda item 8.7, discussion and possible action regarding the initial self-study for new pre-licensure nursing programs. We're going to start with 8.7.1, which is Arizona College Baccalaureate Degree Nursing Program. Arizona College is a new nursing program that has completed the initial continuing approval process. Arizona is located in the Los Angeles area. Enrollment request is 40 students 3 times a year for an annual enrollment of 120 students. Nursing education consultant data research for the Los Angeles region suggests that RNs coming into this area will exceed RNs leaving this area by greater than 2,000 nurses. The nursing education consultant and the program director are available for questions. Thank you.
And then real
Just wanna
quick, this is
comment.
Lori, for the education on here, just so you guys know, acceptance of an initial self-study means that these will become brand new nursing programs. They've completed their application process to have a new nursing program. They've completed the feasibility study that has gone through both the ELC and the board committee, and they have now submitted a self-study. Upon acceptance of this self-study, they will be a brand new nursing program. Thank you.
Thank you, Lori. This is Susan Naranjo. I just have a quick comment. It was mentioned that this is in the Los Angeles area, but the address is in Ontario, California, which is San Bernardino County. So I just want to clarify, it's still the address listed here, or is there a new location in Los Angeles?
I'm going to ask Mary Jane Rosenblatt, because this is Arizona College, and she is a nursing education consultant. BRN moderator, could you promote Mary Jane Rosenblatt to be able to answer the location of the college? And probably the program director, Erica Martinez, as well. Mary Jane, let me know when you're here.
I'm here.
Great. So tell us the location of and about this data that you got for this area.
Thank you very much for asking this question. The location is in Ontario, and the data that we have refers to the greater Los Angeles metro area. So their location is indeed in a different county. I believe Erica is on.
Yes, she is.
Yeah, if she has anything to add to this.
Just to validate, we are in Ontario and in San Bernardino County.
San Bernardino County is an area that has nursing shortage or not?
The data that we have so far includes the Southern California area as a whole in the LA metro. We'll be glad when there's updated information that takes into effect each county as well as COVID and nursing changes.
Thank you, Mary Jane. That is correct, Mary Fagan. The data that we have is in regions, and this would be considered in the LA region.
It is. So this is Lori real quick. The distance between Ontario and LA is 37 miles.
And this is Jovita. So would they be taking away clinical sites from other colleges that are already established? Because isn't LA already inundated with a lot of programs?
It is, but they do have they have to fill out their EDP 18s, which are their clinical facility approvals, and the sites have to attest that they will not displace other programs if they're accepting new programs. My understanding is they do have clinical sites that they have contracts with, and they do have that approval on file.
Yes, this is correct. This is Mary Jane. And there are some interesting partnerships that have been initiated between Arizona College and Corrections Healthcare. Dr. Martinez, would you like to describe those?
Overwhelmingly, our clinical partners are not actually impacting grossly. There is a little bit of overlap with one site, but we are using a date that they had not already been in contract with any other colleges to our knowledge. What Mary Jane is referring to is with the Department of Corrections. We have 3 sites that offer a wide variety of clinical variety, especially mental health and kind of chronic adult health opportunities. And we are very excited as it appears, perhaps due to regulations or difficulty in completing, compliance packets, maybe with the Department of Corrections, but they would appear to be underutilized by other programs.
I have a report that came from OSHPD that is by county for registered nurse shortage areas. Is that data that, Lori, I could swear that you must have sent this to me. Or
Yes,
something.
that's data we can use. Absolutely.
That's broken down a little more discreetly. It's not just LA area or Southern California. I'm trying to just look at it and see, does that show that Ontario is in an area that has a shortage or not?
Mary, this is Mary Jane. I'm sorry, did you say Lori sent it to you?
I thought so. I don't know. I got it early on when I got on the board.
I think, Mary Jane, it's the same list of resources that we have that we can use.
I just looked it up on, OSHPD registered nurse shortage. It was published June 2020, and I understand they do this data every 2 years, so this is the most current.
Feel free to share with us, Mary, what it says.
Yeah, I can't find San Bernardino on the If you look at San Bernardino includes like 29 Palms, is that correct, or is that too far out? Palmdale Lancaster has a medium shortage. I don't see Ontario on Oxnard, Thousand Oaks low, Big Bear area, high, or Big River. 29 Palms medium. Pomona Pasadena is low. So anyway, this is
Yeah, I do have to admit there is a ton of data out there. The programs will have data. We are doing our best to find some data to to share with you.
Yeah, to me, that's one of the most important things as we make these decisions about where the schools are located is there a need in that community, right?
Mhm.
And I'm not sure that we've always had that level of information or.
Well, it's been in the agenda item summary from the nursing education consultants. This is new this time, and that I am presenting all of them, and I'm trying to give just a tiny snippet and a piece of that information so that we can hone in on that. But again, I can only take it from what the NECs do their research on.
And from their research, they said there's more nurses than we need in this area.
According to the LA region. Let me see if Mary Jane put anything else under there. Let's see. This is the regional summit, and I think that was the only one we had on there. There is also discussion about, COVID, but we don't have any data about the COVID effects related to any of this. So we're trying to stay just what we have to date and keeping a pulse on the new data that comes out. Someone needs to put their microphone on mute, please. Thank you.
We know when we will potentially get new data. Any idea about that?
No. Mm-mm. There's been some preliminary data that's coming out, but we're waiting for the final, actual source-based information.
This is Mary Jane. As Dr. McCarthy mentioned, there is preliminary information that's come from UC San Francisco regarding workforce. However, because it's preliminary, it was not included in this report. As I mentioned earlier, it will be extremely helpful when we have current data that reflects the changes in our workforce over the last year and a half.
I do want to mention, Mary, though, that there are several programs that are in Southern California and fit in that Los Angeles area. And in preparation for this and going through everybody's, what they've found and stuff, there has been multiple of the reports that I'm going to be giving you, there is information about Los Angeles, Orange County, and Ventura, which is the greater metropolitan Los Angeles area. I'm trying to think the other one I'm looking through to see. Some of it has to do with workforce. Some of it has to do with graduation, or not graduation, with the number of programs that are expanding, because we've had a lot of enrollment increases and new programs. So some of the research is started to come out with that. And again, just for future reference for the committee and the board, we are adding all this with a link right into our agenda item summaries. And often the programs do as well. And so if you have the ability to review that when you look at the materials and link into those documents, you can see at least what we have from the program and what the nursing education consultants are working from.
Erica Martinez, if I may.
Sure, go ahead, Erica.
Our feasibility study, we were using SPETS data from 2020. And at that time, we were looking at approximately 8,000 FTE shortages in that region. And I am a practicing nurse in addition to being the program director. And COVID is exacerbating it, but it certainly isn't going to create less need, I guess, for FTEs in any of these regions, even without data, I guess, from an anecdotal perspective. And looking at, we're hiring contract labor. We're doing all of these things to try to get nurses in any of these regions. And since we're further west further east, I should say, from Los Angeles market, right? My graduates are predominantly coming from more of Riverside County, San Bernardino County. Those are some of the even harder hit markets currently as far as trying to backfill positions. So I just would speak to, I appreciate we don't have hard data yet, but the data that we did submit for our feasibility and were approved would validate that region would have had many, many vacancies that would support offering a new program.
This is Mary Jane. I'd like to clarify that Arizona College is a baccalaureate. We're looking at graduates being in the market in a few years from now. Ovita, I think you're on mute.
So I've been kind of scrolling through my emails here real quick. This is Lori. They had the UCSF had the workforce data. The newest one was being completed in fall of last year of 2020. And they are in the process of finalizing all of that data, and it should be published to our website here soon so that we can start using that data. Additionally, excuse me, there are the UCSF kind of articles that have been released recently did talk about shortages based on increased retirements from COVID. And they're looking at calling those retirees to action to serve as mentors for the new grads. That is something that does need to be considered. Obviously, this will have some effect on it. We're not sure the totality of that effect. But the other thing to take into consideration when you're looking at other things, job availabilities and postings and stuff, that's to be considered too right now. And I think one of the recent studies that we were able to see is that California is ranking 16 out of 50 for the worst states for finding a job right now for new grads. We are getting emails. My assistant executive officer is getting emails as well saying, I have my license in California and now I'm not able to get a job. And that is something to definitely take into consideration. The other thing that I do want you guys to take into consideration is these are new programs. These are new programs that are being established. This self-study is typically given and passed within a year of them opening. And then this is a baccalaureate program. So that's 3 to 4 years before we will see the graduates from this school. So we can't really predict the future, but that is something to take into consideration, that these students shouldn't be hitting clinicals for another year or two, and then they shouldn't be affecting our workforce in a very positive manner for 3 to 4 years. So these are all preparatory processes to keep and prepare our workforce for the future.
Thank you, Lori. That's very good information to keep in mind. Any other comments from the committee members?
Well, I just want, I know we said that we can't predict the future, but I do like to try to have our decisions be data driven whenever they can. Is it possible to not act on this now and then see if there's additional data when we have the board meeting in November, or do we have to act now as a committee?
You do not need to act now. You can make a motion as the committee to move this to the board for any further action at this point. It does not need to say that you recommend approval. You can actually just move it on. Additionally, if we do get to the board meeting in November and that data is not available, which is unlikely, I am having my chief of licensing right now to see if we can get a definitive date for that release from UCSF. If that is not, we can move this to a further next scheduled board meeting. That is a possibility. We by not taking an action, deferring action does not deny this, and so that is a safe way if you're wanting to gather more evidence to make these decisions.
Yeah, I think that might be the best approach. Susan, I see you shaking your head. Do you want to? Should we make a motion? I'd like to make a motion that we not take action, but bring this forward, the Arizona College program forward for discussion and possible decision at the board meeting in November.
This is Susan, and
I
I'll second.
second. Oh, sorry.
For notes, I guess. I can go ahead and second.
So we have Mary as a first and Susan as a second. Is that correct?
That's it. That's correct. And
Thank you.
so now BRN Monitor, would you take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, thank you, BRN Monitor. Mary Ann, would you please restate the motion?
Yes. 8.7.1. The motion is to move the approval or recommendation of the initial self-study for Arizona College Baccalaureate Degree Nursing Program to the board in November.
So I, Jovita, move to call for a vote. I vote yes. Mary Fagan?
Mary Fagan, yes.
Susan Naranjo?
Susan Naranjo votes yes.
Thank you. Motion carries.
Thank you very much. Moving to 8.7.2. This is also a discussion and possible action regarding the initial self-study approval for a new pre-licensure program. This is Westmont College, which is also a baccalaureate degree nursing program. Now, Westmont College is a new nursing program, and they've completed the feasibility study and the initial continuing approval process. This college is located in the Santa Barbara area. Enrollment requests are 24 students, 2 times a year, for an annual enrollment of 48 students. Nursing education consultant data research for the Santa Barbara area suggests that RNs leaving the area will exceed the number of nurses coming into the area, with a potential shortage of 10% by 2035. The nursing education consultant and the program director are available for questions. Thank you.
Any questions from the members? Then I would like to make a motion to accept 8.7.2. Do I have a second?
I'll second.
Thank you.
I'm sorry, who was the second?
It was Susan Naranjo.
Oh,
Susan Naranjo.
It was Dr. Fagan was the
Yeah, it was
second.
Mary Fagan.
Oh, I
Thank
am
you.
so sorry.
Exactly why we need to know. Thank you
Say
so
my name.
much.
Sorry, I'll say
No
my name.
problem. I thought I heard Susan. So therefore, is there any other discussion from the committee members?
This one to me just feels much more clear because we heard the definitive information that there's a shortage. So that
Yes.
makes it really easy.
Yeah, I agree with you, Mary. So therefore, BRN Monitor, would you please take us to public comment on the related agenda 8.7.2?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Mary Ann, would you please restate the motion?
Yes, the motion for 8.7.2 is acceptance of the initial self-study for a new pre-licensure program, Westmont College Baccalaureate Degree Nursing Program.
I, Jovita, votes yes. Mary Fagan,
Mary Fagan, yes.
Susan Naranjo,
Susan Naranjo votes yes.
motion carries.
Okay, thank you. Agenda item 8.7.3. This is another new program, discussion and possible action regarding an initial self-study for a new pre-licensure nursing program, University of the Pacific entry-level master's degree nursing program. The University of the Pacific is a new program that has also completed their feasibility study and their initial continuing approval process. It is located in the Sacramento area. Enrollment request for the first cohort is for 40 students in April of 2022, followed by 40 students twice a year, starting in January of 23, for a total of 80 students to be enrolled annually. Nursing education, somebody has their speaker on. If you could please mute yourself. I can hear myself talking. I'm sorry. It's so distracting. So sorry. Nursing education consultant data research for the San Joaquin Valley area forecasts that the supply of RNs will decrease due to retirements and relocations at the same time that the demand for RNs is expected to grow because of population growth in this region. The nursing education consultant and program director are available for questions. Thank you.
Any comments from the committee members? I'd like to take a motion to accept 8.7.3. Do I have a second?
This is Mary, I'll second.
Thank you, Mary Fagan. She seconds it. BRN monitor, would you please take, moderator, please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in the request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comment. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Mary Ann, would you please restate the motion for 8.7.3?
8.7.3, the motion is recommend acceptance of an initial self-study for a new pre-licensure nursing program, University of the Pacific entry-level master's degree program.
I, Jovita, votes yes. Mary Fagan,
Fagan, yes.
Susan Naranjo.
And I apologize, before I vote, I just have a quick question as I was scrolling through. Is there tuition information on the report? If it's a new program, I was just trying to find it. It might be here, but I might have glossed over it.
Let me look here. I'm looking on the agenda item summary. You're correct. It's typically on here. But I don't readily see it either. So let's, BRI moderator, could you promote Katie Doherty and Karen Hanford, please, to speak to the tuition of University of Pacific entry-level masters?
You said Karen Hanford, right?
Yes,
Yes.
ma'am. Yes, sir. Sorry.
Sorry. Okay, they're there.
Great. Karen, did you want to speak to the cost of the program, please? Looks like you're on. You should be able to unmute yourself at the bottom.
Okay.
There you go.
The tuition is $1,000 a unit, and the program is 90 units. So the average cost for a student would probably be $94,000, including textbooks and clinical fees.
Thank you so much.
We do also have some student scholarship from a Abbott Foundation. So we do have a 50% tuition reduction for 8 students in each cohort to satisfy the requirements of the donor. These students will have to commit to working in the San Joaquin area for 2 years full time. So we are very excited about that.
That's
Thank you
great
very much.
information. Thanks.
That's great. Thank you so much. Sorry for interrupting the vote.
Oh.
But Susan Naranjo votes yes.
Motion carries. Thank you.
Okay, agenda item 8.8. Okay, so I'm going to preface
So real
this
quick,
with,
Mary Ann, this is Lori, the executive officer. I've been approached by board staff to request a break and or a lunch break. Is that something that our committee would consider?
I would be fine with it.
I'll support that.
Yes.
Are we
how long
thinking
would you like to
30
take a
minutes,
break?
45, what are we thinking?
Jovita, how long would you like to have the break?
I'm okay. I believe somebody said 12:45 and I'm okay with that.
Okay.
Okay, we will be on recess until 12:45. And then we'll come back to start with the agenda item 8.8 of the Education License Committee meeting.
Thank you, everyone.
Committee Chair Dominguez, it is 12:45.
Thank you, BRN moderator. Yeah, let's start with 8.8. Mary Ann McCarthy, Dr. McCarthy, please. Do we,
Should we do
I
a quick
believe that-
roll just to see who's back from lunch?
Yes, thank you.
This is Reza.
I
Thank
just,
you.
after I said that, I said we probably have to do a quorum again. I, Jovita, am present. Dolores Trujillo,
Dolores Trujillo is present.
and is Susan Naranjo present?
Susan Naranjo's here.
Mary Fagan?
Mary Fagan's here.
Perfect. And I see Dr. McCarthy.
Hi. I'm just checking. Is Dolores part of this committee?
Oh, no, sorry.
Okay. I just want to make sure that we weren't missing a vote this whole time.
No,
Okay. Okay, no
just
problem.
saw her and I mentioned her name. But we
No
do
problem.
have a quorum because the committee members are present.
Fantastic. Okay. I'm Mary Ann McCarthy, the Nursing Education Consultant and Liaison to the Education Licensing Committee. We're going to continue with agenda items in number 8.8. All of these 8.8, 1 through 11 are all major curriculum revisions, and we will be addressing each one individually. 8.8.1, discussion and possible action regarding the acceptance of changes to an approved program. 8.8.1 is American Career College Associate Degree Nursing Program, an addition of a new campus or location. So American Career College is requesting a secondary campus in Ontario, California. This is in the Los Angeles region. Enrollment request is for 25 students, 5 times a year, for an annual enrollment of 125 students. Nursing Education Consultant data research for the LA region suggests that RNs coming into this area will be greater than those leaving the area, just as we spoke with before, by the estimate of 2,000 nurses. The nursing education consultant and the program director are available for questions. Thank you.
Any comments from the committee?
This feels like what we were talking about before, like why would we want to increase enrollment if there's already a surplus? And so
I agree with you, Mary, especially that's an enormous amount of students being accepted for that area. How about you, Susan?
I agree with you both. Still kind of reading through the materials.
So let's elevate the program director, Julie France, and the education consultant, Mary Jane Rosenblatt. And you can pose any questions to them, or they can give further information.
This is Mary Jane, and thank you for elevating me to speaker. And yes, actually, this is exactly what we were just speaking of. We are very much looking forward to the release and finalization of the preliminary information from UC San Francisco. And the information from the OSHPOD memo June 25th has been located.
Julie, is there anything you wanted to add?
Yes, thank you. Thank you very much. I would like to add that I'm happy to hear that the OSHPOD data has been located from the June 25th, 2020. And I just want to make sure that we don't have any geographical confusion related to the Inland Empire. The RN shortage areas report lists 72 areas in our state and have designated from a low, medium, and or high designation of RN shortages. And looking at the map in that memo, the Inland Empire represents area 53 and 61, which is designated as a medium shortage. And we are all around the Inland Empire are red areas, which are designated as a high shortage. In addition to that report, in March of 2020, the California Department of Public Health contracted with Aya Health, one of the top traveling nurse providers, to pay up to $1 billion over 6 months to meet the shortages for nursing staffing within California hospitals. This is backed up by the California Hospital Association, stating that staffing is a major problem, and hospitals are stating that personnel is less than at the beginning of this pandemic, necessitating the need for traveler nurses, stretching the resources beyond the breaking point. So I would encourage the collection of all the evidence and data that we have to support this, but there is a true need in the Inland Empire.
Thank you, Julie.
Welcome.
Where
Thank
exactly
you.
is this program located?
The campus site is in Ontario, California.
Is it that's the same campus site where that Arizona was being?
Yes.
Okay.
That's correct.
And again, just for education purposes, we are and have been since October of 2020, adding data and asking our programs to add data links into their materials and AIS for your review on what they find and what we find as far as current data for regional information. Rita, did you want to make a motion?
I'm just thinking about, they were talking about how many students per year accepting them?
It's 25 students 5 times a year for 125 students a year.
That's a lot of students, especially since other schools are in the area. Mary, do you have any comments on that?
You know, I almost feel like we should potentially hold on this one as well as in the board meeting, so we can make some sense of, you know, what seems to be some conflicting data about what the need is.
Yeah, because 155 students and then they accept every five times a year. It's a large amount, and I motion that we place this on November's agenda.
This is
We'll
Susan.
need a
I'll
second. Thank you, Susan.
Thank you, Susan. If there's no more committee member comments, then BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. So, Mary Ann, would you restate the motion, please?
Yes. Agenda item 8.8.1. We are going to move the acceptance of changes to an approved nursing program, American Career College Associate Degree Nursing Program, addition of a new campus, to the board meeting in November.
I'd like to call for a vote. Jovita votes yes. Mary Fagan?
Mary, yes.
Susan Aranco?
Susan Naranjo, yes.
Motion carries.
Thank you very much. Agenda item 8.8.2, discussion and possible action regarding acceptance of changes to an approved program. College of the Sequoias Associate Degree Nursing Program, LVN, Advanced Placement, Enrollment Increase. Now, I want to bring to your attention that 8.8.2 and 8.8.3 are both College of Sequoias. They're asking for an enrollment increase in two separate tracks, so we're going to do them one at a time. The first enrollment increase is for the one in 8.8.2, which is the LVN Advanced Placement. So the College of Sequoias Advanced Placement Program is requesting to continue a previously BRN approved enrollment increase. It was a temporary increase that would expire at the end of this year. This would continue enrollment of 10 LVN Advanced Placement students twice a year for 20 LVN Advanced Placement students annually. Nursing Education Consultant data research from the California Occupational Guide states that registered nursing is a growing occupation in Tulare County at 24.9%, while the projected growth in the state of California as a whole is at 16.7%. The nursing education consultant and the program director are available for questions. Thank you.
Do the committee members have any any statements, comments? I motion to accept 8.8.2. Do I have a second?
This is Mary. I'll second that motion.
Thank you, Mary. So let's, BRN moderator, would you take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box. I would like to make a comment. Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Marianne, would you restate the motion?
Yes. Yes. Agenda item 8.8.2, recommend acceptance of changes to an approved nursing program, College of the Sequoias Associate Degree Nursing Program, LVN Advanced Placement, enrollment increase.
I'd like to call for a vote. Jovita votes yes. Mary Fagan?
Mary votes yes.
Susan Naranjo?
Susan Naranjo votes yes.
Motion carries.
Thank you very much. Agenda item 8.8.3, discussion and possible action regarding acceptance of changes to an approved nursing program. Again, this is the College of Sequoias, but this time it is their associate degree, their regular track for their ADN program for an enrollment increase. So the College of Sequoias ADN program is requesting a one-time enrollment increase of 20 generic students in May of 2022. This would be a one-time, part-time addition that students could take the program part-time over a period of 2 years. College of Sequoia currently enrolls 40 students twice a year, and this would increase them to 60 students per year only for that 1 year that they're enrolling the extra 20 students and as they progress through the program. NEC data research suggests that projections of supply and demand through 2023 indicate that the RN shortage will worsen in coming years. in this area because of the educational capacity and migration of RNs to the region are not enough to keep up with population growth. The NEC and the program director are available for questions.
Any,
This is Mary. I'm just wondering why they want to do this one-time, part-time option. I wonder what's driving that.
My understanding, and we can ask them to speak to this, Mark, this would be Belen Kirsten and Jeanette Wackerly. But my understanding, and they'll correct me if I'm wrong, is that there is a need of these of students asking for this to go part-time because they're having trouble meeting the full-time commitment. So this would allow them to not be in a full-time program, but a part-time program where they could take their courses one at a time over 2 years.
So this is current students who want to move from full-time to part-time to help?
No.
No?
No, it would be a new group. They already have their enrollment of 40 students twice a year, their regular track. And this would be a one-time request starting in May. They want to enroll 20 more students into the generic program, but only in a part-time. They'll be on a different track. They'll be taking one course at a time over 2 years.
Is this like a pilot program or something to see if it's successful? Or I guess we can let them speak.
Yeah.
I was thinking the same thing, Mary.
Belen, are you available? And
Yes.
could you speak to this, please? Thank you.
Yes, can you hear me?
Absolutely. Go ahead.
So actually, this happened back in 2006 and also another program in 2008 where we accepted working adults who would take courses in the evening, the one class at a time. And then every other weekend, the cohort of 20 would be divided into 2 groups of 10. And every other weekend, Group A would work on a weekend, and then Group B would be this following weekend. And as it progressed, it ended up being about 25 months where the students could still have their daytime job. And we thought that it was an equity issue in allowing students who are working, who always wanted to be registered nurses, a method of them to take our program, our full program, one course at a time.
So is this something you want to continue to offer, but you only need to do it part-time because it takes them longer to complete? Is that?
It's going to take them, they go year round rather than the current generic students go only semester and semester. So this would be every week. They'll have Christmas and Thanksgiving off and Easter, but for the most part, be one class. They'll be going for 26 or 25 months for this program to be completed.
I guess my question is, why is it just a standing part of your program if it's successful?
Okay, so the first time that it was offered in 2006 and 2008, it was offered with grant money. This time, the college is behind it and to support it. I have a full-time faculty right now who actually was in the very first 2006 cohort, and she has gone on and has her master's and been teaching for us for over 6 years. So it's a very successful program, but at that point back then, I think it was 2008 when they graduated, and then there was that economic downturn, and so we reduced our numbers. We were actually at 80 students every semester, and we went down to 70 to 60 to 40.
Thank you.
Okay, so did we already we haven't made a motion on this, correct, or did we?
Not yet. Not yet.
Okay. Any other comments from the members?
I do have a question. This is Belen Kirsten again. We just asked for this one time because we didn't know if it would be filled but if we needed to ask for it again, we would have to come back in 2 years to this
Yes,
committee.
as it stands right now, as your request stands right now, yes, Belen, that is true.
Okay, thank you.
I wish you success with this. Sounds like a lot of students will hopefully take advantage of it.
Yes.
And
especially-
Jovita, I think I misspoke. I think you guys might have taken a motion with Jovita motioning and Mary seconding. Or was that the last one? I'm sorry, I'm getting these two. That was the last one. Thank you. Thank you for helping my memory.
Yeah, the
So we-
first Sequoia.
Yeah,
So
so we do need a motion.
yes, thank you, Mary Ann. Any other comments from the board, from the members? Okay, so I motion that we accept 8.8.3. Do I have a second?
I'll second. It's Mary.
Thank you, Mary. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please, thank you. Mary Ann, would you restate the motion?
Yes, the motion for 8.8.3 is to recommend acceptance of changes to an approved nursing program, College of Sequoia's Associate Degree Nursing Program, to add a one-time enrollment increase of 20 generic students in May of 2022.
Thank you. I will call for a vote. Jovita Dominguez votes yes. Mary Fagan?
Mary Fagan, yes.
Susan Naranjo?
Susan Naranjo votes yes.
Motion carries.
Thank you very much. Agenda item 8.8.4, discussion and possible action regarding the acceptance of changes to an approved nursing program. Concordia University, Irvine, Baccalaureate Degree Nursing Program enrollment increase. Concordia University or Irvine is requesting an enrollment increase to add a third cohort to their nursing program. CUI is located in Orange County, which is in Southern California. Concordia currently enrolls 2 cohorts of 64 students and requests to add a third cohort, phasing in the number of students enrolled over time until the 64 maximum student cohort limit is met. NEC data research suggests that the Los Angeles region of California, which includes Los Angeles, Orange County, and Ventura counties, has a growing supply of registered nurses due to the expansion of local RN education programs and satellite campuses. Projections of supply and demand through 2035 indicate that the RN shortage may exist now, but is likely to dissipate during the rapid supply growth. A surplus of RNs is possible in the future. I am the nursing education consultant for Concordia University Irvine. Myself and the program director are available for your questions.
I feel like we've already saturated Orange County. Does anybody have any comments on that? Increasing would probably put more of a burden on that area.
Where in Orange County is this, is it located?
Irvine?
We have conflicting data. Sorry.
And Mark, let's promote Cheryl Smythe Padgham, the program director at Irvine, please. so she can speak to this? Cheryl, I think you have been promoted. If you can unmute.
Yes, I'm here.
Thank you, Cheryl. Mary, what was your conflicting data?
Oh, I'm looking again at the OSHPD data, and it's
Oh, okay.
to Anaheim, Santa Ana area. It says there is a shortage, but that it's low, is what I'm seeing on this OSHPD.
Yes, and I'm just going to remind you that there's tons of data and that the programs provide the data and we research data and we just do the best we can to, I mean, of course, the program wants to support data and we just want to make sure that both sides of the data are presented to you guys so that you can make an educated decision.
Would you like me to speak to that?
Sure. Go ahead, Cheryl.
Hi, thank you for letting me speak. We do
course.
know that with the OSHPD data in June of 2020, the latest data does say that Orange County is in a designated shortage. We are anecdotally hearing from many of our nurses in this region that they are leaving the profession and or the numbers of people quitting the acute care setting is increasing. So we believe that those numbers are going to be, we're going to have a drastic problem here in a very short term. So that's the reason for this. And we produce very good nurses who tend to stay in these regions and also come back to teach with us as well.
I think we may want to treat this the way we treat the others, where we're just
Yeah.
not sure about the data.
Yeah.
We can-
Mark, we can hear you. If you could mute yourself, please.
Sorry.
Go ahead, Mary.
Maybe, I mean, I'd like to make a motion that we move this on to the full board meeting for discussion in November, when we can have maybe a little more time, and if there's more current data to take a look at what the predictions are.
I second your motion, Mary. So, so should we take it to public comment?
Yes, please.
BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please, thank you. Mary Ann, would you restate the motion?
Yes, agenda item 8.8.4. The motion is to move the enrollment increase for Concordia University Irvine to the board meeting in November of 2021.
I call it for a vote. Jovita Dominguez votes yes. Mary Fagan,
Mary Fagan votes yes.
Susan Naranjo,
Susan Naranjo votes yes.
motion carries.
Thank you very much. Agenda item 8.8.5, discussion and possible action regarding accepting changes to an approved nursing program. 8.8.5 is Imperial Valley College Associate Degree Nursing enrollment increase. Imperial Valley is requesting an enrollment increase. The program is located adjacent to the U.S.-Mexico border. Imperial Valley is currently enrolls 30 students twice a year And then they would like to increase to 50 students in the spring only and continue with their 30 students every fall. This enrollment increase would be from 60 students per year to 80 students per year. Nursing education consultant data research suggests that the data collected on the southern border concludes a mostly perfectly balanced labor market at this time. The NEC and the program director are available for your questions.
I have a question. Would they be able to hold the clinical sites for Imperial Valley? Because that area doesn't have a lot of, if I remember correctly, they don't have very many hospitals, right?
Well, let me have the moderator elevate Crystal Mora and the NEC Donna Ship, and we will ask. Crystal, let me know when you are able to speak.
I'm here. Thank you. Hi,
Thank you so much, Crystal.
no worries. We have currently we have two hospitals that are willing to take our students, and they're open to evening, weekends. So we do have the clinical sites. We also have lots of clinics, and we also have home health agencies. And the only agency that we will use for psych is Alvarado Parkway Institute, and they are willing to take the additional students as well. So we have clinical sites.
And do I recall the number right now you accept 30 per semester, which would be 2 semesters, and you want to increase to 20 each semester?
So each semester we enroll 30, and it would increase to 50.
50 in the spring only, am I correct, Crystal?
I thought it was for
Because I don't know, I had down that you were going to have 50 students each spring and you're going to stay with your 30 each fall.
Yes. Well, it should be 30 and then 20. 20 would be for the LVN to RN.
Can someone just run through those numbers one more time? Because I'm
Yeah, Donna Ship, could you please help us understand the enrollment increase, please?
Yes, absolutely. So they are currently enrolling 30 students twice a year. What they are wanting to do is add an additional cohort of just the LVN to RNs. They will be having these students attend weekend and evenings to help prevent any overlap with existing students in clinical placements. The two facilities have written letters of support that they can provide those clinical settings without displacing any other students. And so with them doing this, they will enroll the additional 20, and if approved, they're wanting to start this in the spring, but they will only be doing it once a year because these are the LVN to RN. So they will wait till one cohort completes before they enroll another, which again would limit them to doing this just once a year. So their annual enrollment is being increased by 20, and again, it's for LVN to RN.
Okay.
Yes, that's correct.
Does that help, Susan?
Yes, thank you.
So, okay, so then any other comments? I motion that we accept 8.8.5. Do I have a second?
I'll second.
Is that Susan?
Who is that?
Oh, sorry, Mary Fagan.
Mary. Sorry, Mary. You sound like Susan. Perfect. BRN moderator, would you take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Marianne, would you restate the motion, please?
Yes, agenda item 8.8.5. The recommendation is to accept the changes to an approved nursing program, Imperial Valley College Associate Degree Nursing Program enrollment increase.
I'd like to call it for a vote. Jovita Dominguez votes yes. Mary Fagan,
Mary Fagan, yes.
Susan Naranjo,
Susan Naranjo, yes.
motion carries.
Thank you very much. Agenda item 8.8.6. Discussion and possible action regarding acceptance of changes to an approved program. Monterey Peninsula College Associate Degree Nursing Program enrollment increase. Monterey Peninsula is requesting an enrollment increase from 32 to 40 students twice a year, beginning in the spring of 22, and every fall and spring semesters thereafter. The program is located in the Central Coast region. The annual enrollment would increase from 64 students to 80 students per year. And this program is also going to make a major curriculum revision in order to reduce their clinical hours for pediatric clinicals from 54 to 40 hours with this curriculum revision. Nursing education consultant data research suggests large differences across regions with the substantial shortages projected for the Central Coast. The nursing education consultant and program director are available for questions. Thank you.
I have a question. This is Jovita. Will there be enough clinical sites for the additional LVN to RN students coming in? I believe you said 20, correct?
They're going to enroll from 32 to 40 twice a year.
Oh, okay, from 30, so 8,
So
okay.
it's what is that? 8 students twice a year is 16 students. Yeah, so just below 30. We can promote Laura Loop and Katie Doherty to speak to this, but generally, Jovita, if they're coming to you, unless there's a mention, we always explore clinical displacement with our programs, and they do have to have those EDP 18 clinical contract consent forms approved by us so that there is documentation that there will be no displacement.
Okay.
Laura, are you able to speak?
Yes, this is Laura Loop. I can address that.
Thank you so much, Laura.
Certainly. So just one correction, we only admit once per year. So that would be an additional 8 students once per year.
Okay,
It's just that we're
my
starting
mistake.
in the-
So sorry. Thank you for correcting.
Oh.
So it's 8 students a year, correct?
No worries. Yes, it's just that we wanted to start in the spring, so that's why
Got it.
we normally admit in the fall. So the LVN group would start in the spring, and then every semester or every annually after that, we would admit 40 per year. And I believe the question was about clinical sites. We definitely have enough clinical sites. We are all set for the spring, and we have filed all of our EDP P18s. And even with that pediatric reduction, we have adequate sites moving from 54 to 48 to 40 hours, regardless if it's 32 or 40 students. Yes, we have adequate clinical sites.
Thank you. The reason I asked was because I was picturing 20 students, so that's why I was asking. Thank you very much.
Yes, thank you.
Any other comments from the members? I'm glad to hear that MPC is going to increase to the LVN to RN. I motion that we accept 8.8.6. Do I have a second?
This is Mary, I'll second.
Thank you, Mary. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Marianne, could you restate the motion?
Absolutely. Agenda item 8.8.6. The recommendation is to accept the changes to an approved nursing program, Monterey Peninsula Associate Degree Nursing Program enrollment increase.
So I call it to a vote. Jovita Dominguez votes yes. Mary Fagan,
Yes.
Susan Naranjo,
Susan Naranjo, yes.
motion carries.
Thank you very much. Agenda item 8.8.7. Discussion and possible action regarding the acceptance of changes to an approved program, Sacramento City College Associate Degree Nursing Program enrollment increase. Sacramento City College is requesting the permanent continuation of a previously approved temporary enrollment in the LVN to RN advanced placement track. Enrollment for this track is 10 students each spring, therefore 10 students annually. The traditional track enrolls 30 students twice a year, so the total with this addition of these 10 students annually would be 70 students enrolled per year. The program is located in the Sacramento area. An NEC data research suggests a balanced labor market and growth of graduations might be more than needed. The report indicates that this is not something to be worried about. The report also suggests that long working lives in nursing will be important to maintain a balanced supply and demand of RNs in this region. The nursing education consultant and the program director are available for questions. Thank you. You're on mute, Jovita.
Thank you. Any questions or comments from the members? So I motion to accept 8.8.7. Do I have a second?
This is Mary. I'll second that motion.
Thank you, Mary. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Marianne, would you restate the motion?
Yes, agenda item 8.8.7. The recommendation is to accept the changes to an approved nursing program, Sacramento City College Associate Degree Nursing Program enrollment increase.
I'd like to take it to vote. Jovita Dominguez votes yes. Mary Fagan?
Mary Fagan, yes.
Susan Naranjo?
Susan Naranjo, yes.
Motion carries.
Thank you so much. Agenda item 8.8.8, discussion and possible action regarding acceptance of changes to an approved nursing program. San Joaquin Delta College Associate Degree Nursing Program enrollment increase. San Joaquin Delta is requesting a permanent continuation of previously approved temporary enrollment increase of their fast-track option. This program is located in the Central Valley. The traditional track has 40 students twice a year for a total of 80 students a year. The fast track has 40 students one time a year. and the annual enrollment of the total program, which they have been doing. And again, this was previously temporarily approved and will be coming to an end. It was approved until 2020. So they need reapproval to continue. The annual enrollment will be 120 students. NEC data research suggests supply and demand. Reports identify the need for more new RN graduates in this region, and it continues to have a low supply of RNs, and the population of the San Joaquin Valley continues to grow. The nursing education consultant and program director are available. Thank you.
Is there any questions from the members? I motion that we accept 8.8.8. Do I have a second?
Mary, I second.
Thank you, Mary. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Marianne, would you restate the motion?
Agenda item 8.8.8. The recommendation is to accept changes to an approved program, San Joaquin Delta College Associate Degree Nursing Program enrollment increase.
I take it to a vote. I, Jovita Dominguez, votes yes. Mary Fagan?
Fagan, yes.
Susan Naranjo?
Susan Naranjo, yes.
Motion carries.
Thank you very much. Agenda item 8.8.9. Discussion and possible action regarding the acceptance of changes to an approved nursing program. This program is San Joaquin Valley College Associate Degree Nursing Program enrollment increase. San Joaquin Valley is requesting 6 additional students to be added to their LVN to RN cohort at their Visalia site. They also have a site in Ontario, California. The Visalia site is located in the Central Valley. Nursing education consultant data research suggests substantial shortages are projected for the San Francisco, Central Valley, and Central Coast regions. While surpluses may arise in Sacramento and Los Angeles, the forecast accounts for population growth, population aging, and anticipated changes in the number of new RN graduates. The NEC and the program director are available for questions. Thank you.
Any comments from the members? I motion that we accept 8.8.9. Do I have a second?
I'll second that.
Is that Mary? Thank you. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Mary Ann, would you restate the motion?
Agenda item 8.8.9. The recommendation is to accept the changes to an approved nursing program, San Joaquin Valley College Associate Degree Nursing Program enrollment increase.
I'd like to take it to a vote. Jovita Dominguez votes yes. Mary Fagan?
Mary Fagan, yes.
Susan Naranjo?
Susan Naranjo, yes.
Motion carries.
Thank you so much. Agenda item 8.8.10. Discussion and possible action regarding acceptance of changes to an approved nursing program. Stanbridge University Baccalaureate Degree Nursing Program enrollment increase. Stanbridge University is requesting an enrollment increase on 2 of their campuses. These campuses are in Orange County, one's in Orange County, and the other is in Los Angeles. Orange County campus currently enrolls 30 students 3 times a year for an annual enrollment of 90 students. The request is for 40 students 4 times a year to increase to 160 students annually. So for Orange County, this would be an additional 70 students annually. Now for Los Angeles. Los Angeles currently enrolls 35 students 4 times a year, which is 140 students annually. The request is for 40 students 4 times a year, so going to 160 students annually, and this will be an additional 20 students per year. So between both campuses, it will be an increase of 90 students per year. Nursing education consultant data suggests that the Los Angeles region of California, which consists of Los Angeles, Orange, and Ventura, has a growing supply of registered nurses due to the expansion of local education programs and satellite campuses. Projections of supply and demand through 2035 indicate an RN shortage may exist now, but is likely to dissipate due to the rapid supply growth. A surplus of RNs is possible in the future. The nursing education consultant and the program director are available for questions. Thank you.
Does anybody have comments, questions on Stanbridge? I feel like it's already a lot of colleges and students in both LA and I believe you said Orange County, right?
Yes, one campus is in Orange County, one campus is in Los Angeles.
Yeah. Any thoughts on this, members?
Wonder, Jovita, if we want to also handle this one the way we've handled some of the others. I mean, it does sound, I think maybe more clearly that there is a surplus in these areas, but just until we can see the latest data and if we do get data that shows any impact that COVID has had.
I agree. So maybe I'd like to motion that we bring this to the board members in November.
I second that.
Thank you. BRN.
That was Mary Fagan. That was Mary Fagan, just for
yes,
the note
yes,
takers.
Mary
Thank you.
Fagan. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for a comment. I've activated the question and answer feature. Members of the public can indicate that they would like to make a comment by typing into the question box, I would like to make a comment. Please remember you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, I would like to make a comment. Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Mary Ann, would you please restate the motion?
Agenda item 8.8.10. Recommend acceptance of changes to an approved program, Stanbridge University Baccalaureate degree. Oh, I'm sorry. I'm very sorry. Actually, we're not going to accept any changes. We're going to move this decision to the board for any changes related to the enrollment increase of Stanbridge.
Thank you. I'd like to take it to a vote. Jovita Dominguez votes yes. Mary Fagan?
Mary Fagan, yes.
Susan Naranjo?
Susan Naranjo votes yes.
Motion carries.
Thank you very much. Agenda item 8.8.11, Unitech College, possible discussion and possible action regarding the acceptance of changes to an approved nursing program. Unitech Baccalaureate degree nursing program is requesting an addition of a new campus.
And we're with
Hang on. Sorry. Unitech College is requesting an additional campus in Sacramento, California. Unitech currently has campuses in Fremont, Bakersfield, and Concord. Enrollment request for the new campus is 40 students 3 times a year for an annual enrollment of 120 students. Nursing education consultant data research for the Sacramento region of California, which consists of counties in Sacramento and Yuba City, has a growing supply of registered nurses due to the expansion of local RN programs and satellite campuses. Projections of supply and demand through 2035 indicate that the RN shortage may exist in 2018, but will dissipate over the next decade, with an oversupply of RNs possible by 2035. I'm their NEC, and the program director is ready and willing to speak regarding this new site. Thank you.
Do members have any questions on the added campus?
Hey, Navita, I feel like this too is similar to some of the other discussions we've had where it's just hard to tell. You know, just push it straight to the board.
Yeah, to the whole board. I motion that we take 8.8.11 to the board meeting in November. Do I have a second?
This is Mary, I'll second.
Thank you, Mary.
Jovita, I would like to before we go to public comment, I would like to give the program director, Abdel Yosef, the chance to speak, please.
Yes, please.
Thank you. Abdel, you are up, and I think you can unmute your microphone. Thank you.
Thank you, Marianne. Thank you for this, and thank you, the Education Committee. I would like to present the Sacramento need in 3 areas. First, I want to talk about the population increase. The older population grew by about 40% between 2010 and 2019 in Sacramento. At the same time, the age, there are 27,000 RNs in Sacramento. 22% of them are over the age of 60, which is about 6,000 RNs are above the age of 60. And due to the pandemic and what's happening over the last 2 years, as we all agree that there are more nurses, many older nurses will be leaving nursing, within the next few years. In addition to that, although you can see like Sacramento says that there is a low shortage, but we draw students from Stockton, Tracy, Manteca, and actually we have 5 of the hospitals that we are going to have training at are in Stockton and Tracy. So going back to the number of nurses, 6,000 nurses could retire within the next 5 years. If we start our BSN program in 2022, this is what we propose, we will graduate the first cohort in 2025, which is 120 students. That would be 2% of the 6,000 that we potentially going to lose over the next 5 years. And every year we're going to lose more of those. So what we're trying to do is to help get in front of the problem before it happens. And we look at it from elderly population. Sacramento had the second largest regional population increase since 2019. Sacramento city is the fastest growing major city in California. 40% of the population in Sacramento are considered elderly. And the nurses, as I said, 22% of the nurses are above 60 years old. And we draw students from, as I said, Stockton, Tracy, Manteca, and according to the report, it shows it's a medium shortage already in that area. In addition to that, we have 56 clinical sites that we already have secured, 14 acute care hospitals and other facility. And with this campus we have in Sacramento has 360 VN students enrolled in the program, in the VN, and they have been having a pass rate above 90 year over year. So we have a great campus. This community is going to need nurses for sure over the next few years. And what we're doing is going to be a small dent in the shortage, to be honest with you, because of the age of the workforce, the age of the population, and also you cannot just isolate Sacramento. You have to look at it within the region, which is Stockton, Tracy, Manteca, which has already been identified as a medium shortage. And as like Sacramento City College presented earlier in this meeting, and also University of Pacific presented in this meeting where they both been approved because of the shortage. So we're not in Orange County, we're not in LA. So I would like to answer any further questions you have.
Thank you.
Thank you.
Thank you for your statement. Any members have comments?
Just, I think that's all good data to bring to the full board in November. I don't automatically associate Manteca with Sacramento. And so for me, hearing a program in Sacramento, I don't automatically associate with the regions identified. And so I understand that, but then also to hear the data that conflicts with the general statement that there will be a surplus in 2035, I think those are all important factors, but still agree with my fellow committee members to bring it to the board in November.
Thank you, Susan. BRN moderator, would you please take us to public comment?
We will be opening for public comment now. I will be activating the question and answer feature. Please refer to the screen share for members of the public to see how they should type in their request for comment. I've activated the question and answer feature. Members of the public can indicate they would like to make a comment by typing into the question box, "I would like to make a comment." Please remember, you will have 2 minutes to make your comments. I will not give a reminder as your time approaches. I do not want to interrupt you nor cause you to lose your train of thought. I will mute your microphone and inform you that your time has expired, and we'll move on to the next member of the public. I'll pause for a moment for members of the public to type in, "I would like to make a comment." Committee Chair Dominguez, there are no public requests for comment. Would you like me to close this window?
Yes, please. Thank you. Mary Ann, would you restate the motion, please?
Yes, agenda item 8.8.11. The recommendation is to move the addition of additional campus for Unitech College Baccalaureate degree nursing program to the November board meeting.
Thank you. I'd like to take it to a vote. Jovita Dominguez votes yes. Mary Fagan?
Mary Fagan, yes.
Susan Aranco?
Susan Aranjo, yes.
Motion carries. I believe this
Thank you.
concludes the eight.
Jovita, if I could just make one statement, please,
Yes.
as the liaison to the Education Licensing Board Committee, I would really implore with the committee and with the board as a whole to please take the time to research the data and information given by the program and the nursing education consultants in regards to these decisions. As NECs and myself as the liaison as well, are only in a position to provide information for your decision. We can't make any decisions or recommend either way. So all of this information will remain in the materials on the board website and will be moved and possibly things added for the board agenda. So I know it's a lot, but if you could please, especially the ones that are in question, take the time to research those areas, those data, the things that have been presented in materials by the programs and the nursing education consultant. It would be greatly appreciated.
Thank you. Yes, I do intend to spend more time on the ones that we moved for November. Thank you, Mary Ann.
Also, this is Lori, the EO. I will try to gather data from the last 2 years of all of the enrollment increases that the board has approved and the locations that they approve those in. I think that will be helpful data for us to have, because that will show the growth that is already approved to occur by the board. I think that's a data point that we are missing. So I will make an attempt to gather that data and have that present for the November board meeting. Additionally, I will go through and pull the data of the new school approvals and where those schools were approved to take place in, and the enrollment data for that. I think that it would be important to have it on a simple table, and I will put that into a table and include it into the materials. It would not be specific to a agenda item, but it would be data that would be helpful for you guys to take into consideration. I can report out that in the past 2 years, we have seen greater than 10,000 new licensees from year to year. And so in the past 2 years, we've increased our initial license in California by 10,000. So we do have an increase. And our pipeline of nurses, even through COVID, has remained secure when we feared that we would not be able to progress or graduate our students. So I think that additional data, as well as the data that's being submitted to you guys for review from the NECs, will be helpful in making a better informed decision in November. Thank you, guys.
Thank you, Lori, for the future info. We appreciate it. This concludes the Education and Licensing Committee. I appreciate everybody's time and effort. Thank you.
Thank you.
I believe we go to 9.0, Dolores?
Jovita, we will adjourn at 1:55 p.m., correct?
Yes.
Thank you.